Welcome to TUTIN Ontario PSW Exam Prep. This video covers Module 11 on cognitive health, focusing on dementia, delirium, and mental health. We will review and explain exam-style questions for Part 1, questions 1 to 10. Let's begin with question 1. Sudden confusion and agitation in an older adult with a previously clear baseline should be treated as Option A, a potential medical emergency. Option B, a likely age-related change that can be monitored routinely. Option C, a behavior concern to address after other care tasks are finished. Option D, a communication issue that usually improves without reporting. Take a moment and choose the best answer. The correct answer is A, a potential medical emergency. Sudden onset confusion can indicate delirium, infection, low oxygen, or other urgent issues. Always report promptly and follow escalation policy. Moving to question 2. A person showing apathy is least likely to demonstrate. Option A, lack of interest in activities. Option B, sitting for long periods without initiating. Option C, reduced engagement. Option D, increased motivation to begin several new goals independently. Take a moment and choose the best answer. The correct answer is D, increased motivation to begin several new goals independently. Apathy involves reduced motivation or interest. Therefore, sudden energetic initiative is not a typical demonstration of apathy. Here is question 3. In an information processing model for behavior, which statement is least accurate? Option A, feelings influence how a person responds. Option B, internal triggers can shape interpretation. Option C, thoughts and feelings can lead to behavior. Option D, each memory creates one fixed emotional response in every situation. Take a moment and choose the best answer. The correct answer is D. Each memory creates one fixed emotional response in every situation. While emotions and memories are linked, it is not accurate to claim every memory always has a fixed emotion in all cases. Moving to question 4. A client strongly believes they are the ruler of the world, despite clear evidence this is not true. This is best described as Option A, grandiose delusion. Option B, persecutory delusion. Option C, hallucination. Option D, confabulation. Take a moment and choose the best answer. The correct answer is A, grandiose delusion. A grandiose delusion is a fixed false belief involving exaggerated power, importance, or identity. Here is question 5. A client has periods of unusually high energy, little sleep, rapid speech, and then later severe low mood. Which condition may this pattern suggest? Option A, bipolar disorder. Option B, major depression without any high energy episodes. Option C, delirium caused by an acute infection. Option D, generalized anxiety disorder. Take a moment and choose the best answer. The correct answer is A, bipolar disorder. Bipolar disorder involves mood episodes that may include mania or hypomania and depression. PSWs do not diagnose but should observe, document, and report changes.
Here is question 6. When supporting a client in a manic phase, which approach should the PSW avoid? Option A is keeping communication calm and simple. Option B is reducing stimulation where possible. Option C is arguing intensely or challenging every statement to prove reality. Option D is reporting safety concerns promptly. Take a moment and choose the best answer to the question. The correct answer is C, arguing intensely or challenging every statement to prove reality. Mania involves high energy, impulsivity, and reduced sleep. Arguing or escalating stimulation can worsen risk, so PSWs should use calm support and report concerns. Next is question 7. A client collects large amounts of items and becomes very distressed when asked to discard them. This behavior may be described as Option A is hoarding. Option B is perseveration. Option C is apathy. Option D is compulsive pacing. Take a moment and choose the best answer. The correct answer is A, hoarding. Hoarding involves persistent difficulty discarding possessions and can create safety and hygiene concerns. PSWs report concerns and follow the care plan. Here is question 8. Which observation is most consistent with a manic episode? Option A, very high energy, rapid speech, little sleep, and risky behavior. Option B, low mood, slowed speech, and withdrawal from activities. Option C, short-term confusion that begins suddenly with infection. Option D, gradual memory decline over several years. Take a moment and choose the best answer. The correct answer is A, very high energy, rapid speech, little sleep, and risky behavior. Mania can include increased energy, decreased need for sleep, rapid speech, impulsivity, and poor judgment. Changes should be reported. Here is question 9. A person repeatedly eats large amounts of food and then tries to compensate by self-induced vomiting. This pattern is most consistent with option A, bulimia nervosa, option B, binge eating without compensatory behavior, option C, anorexia nervosa with severe restriction only, option D, gastroesophageal reflux disease. Take a moment and choose the best answer. The correct answer is A, bulimia nervosa. Bulimia nervosa commonly involves binge eating followed by purging or other compensatory behaviors. It requires professional assessment and support. Next is question 10. A client with schizophrenia tells the PSW they hear voices and strongly believes they have special powers. Which observation should the PSW report? Option A, possible hallucinations and delusions of grandeur. Option B, increased spiritual expression requiring routine documentation only. Option C, confusion that should be treated the same way as dementia. Option D, a communication change that should be monitored without reporting. Take a moment and choose the best answer. The correct answer is A, possible hallucinations and delusions of grandeur. Hearing voices can be a hallucination, and believing you have special powers can be a delusion of grandeur. PSWs must report changes or distress to the nurse or supervisor. Great work. Keep practicing with TUTIN. Visit the link in the description for full practice questions and mock exams to study smarter.